Good afternoon, and welcome to the Rising Stars podcast, Public Health Edition. Today, we're bringing an incredible and extraordinary group of emerging Pakistani American leaders who are shaping the future of public health. In this special episode, we sit down with APF's Rising Stars in Public Health to explore their journeys, challenges, and stories defining the field today, and the work they're doing to advance public health, equity, preparedness, and community resilience. Through this conversation, we aim to highlight the power of leadership, service, and innovation, and inspire the next generation to make an impact where it matters the most. I would like to introduce our host, Dr. Sayra Madad, who is a globally recognized public health leader and epidemiologist shaping the future of biopreparedness, infection disease response, and health system resilience. She serves as the Chief Biopreparedness Officer at New York Health Plus Hospitals, the nation's largest municipal healthcare system. As a trusted advisor to governments and institutions, she serves on multiple national advisory boards and is a fellow at the Harvard Kennedy School Bethler Center. Known for translating complex science into action, Dr. Madad is one of the most influential voices guiding preparedness in an increasingly uncertain world. Welcome, Dr. Sayra. Now, I'd like to introduce our guests, who are our special rising stars in public health. First off, we have Samira Khan, a public health leader advancing health equity in a community-centered research, advocacy, and education. She serves as the president of the South Asian Public Health Association, known as SAFA, leading national initiatives on mental health, chronic disease, aging, and health misinformation in South Asian communities. Samira also serves on the board of NAPIMA as an assistant director of research and clinical initiatives at the Icahn School of Medicine at Mount Sinai, where she oversees clinical research and quality improvement efforts. Next up, we have Fatimah Amer, who is a public health speaker, nonprofit founder, and researcher recognized as the youngest first author on a UN policy paper. She has received numerous awards, including Arizona's 18 Under 18, 30 Under 30, and the Stella Care Innovation in Health Equity Award. A proud daughter of Pakistani immigrants from Lahore, Fatima mentors young students pursuing medicine and is passionate about the future of AI in healthcare. Lastly, but not least, we have Maryeba Fawad. Maryeba Fawad is an early career public health professional working at the intersection of health policy, federal consulting, and global health. She is the lead federal health policy consultant at Acumen, supporting CMS initiatives, and serves as the chair of Acumen's DEI workgroup. Her experience spans consulting for UN Women, public health law at CDC, co-authoring research in Nature Human Behavior, and founding the Minority Health Sciences Conference, now in its 5th year. Welcome to our lovely guests and our host, Dr. Sayra Madad. Over to you, Dr. Madad.
Thank you so much, Maha, for those very kind and generous introductions to myself and to our amazing rising stars. And so I'm gonna, get right into it. I want to first again welcome everybody to this podcast. I'm honored to serve as the board lead for APF's Rising Stars in Public Health. And I wanted to, I think, start off by sharing a personal note. I'm first generation Pakistani American, and I'm also the first person in my family to actually go into the field of public health. So, growing up, I didn't have a roadmap for what public health career could look like. There weren't many examples that looked like me, and there wasn't a clear script for how to get to where I am today. So I know what it means to build your own path while carrying your community forward with you. And being in today's world, and I'll be honest, public health feels very different today. And I'm sure each of you probably feel very similarly in the corners of the world that you sit in today. The work has become increasingly politicized, and in many moments, it can feel like we're drinking from a fire hose. New threats, new misinformation, disinformation, new pressure, and constantly there's an urgency to make sure that we are sharing the most factual, up-to-date information with our communities, our family, our friends. And often it feels like we have to do it all at once. But even then, it's intense and the mission stays the same, which is to protect people, to build trust, and to make sure communities aren't left behind. And that's why our conversation today is just so important. And I'm so thrilled to be talking to all three of you as APF's Rising Stars. This initiative exists really to elevate emerging leaders like yourself, our Pakistani American women who are shaping the future of health, equity, preparedness, policy, and community resilience. And so I'm thrilled to be joined by three incredible rising stars, Samira, Fatima, and Maryeba. So we're going to jump right in. And I'd love to ask each of you a question to start us off. And so you can spend a couple of minutes just sharing your own personal story. I feel like oftentimes we say public health has a problem of not enough storytelling. And so I want to give you the platform to really share what is your story and why you chose to pursue a field in public health or a career in public health. And if you want to share any defining moment that you think would resonate with other people to make them realize that this may be their calling as well. And so maybe Samira will start off with you.
Absolutely. Thank you for having me, Sayra. I think my journey to public health, as is most people's journeys to public health, is not very linear. In undergrad, I was pre-med, and so I was taking all the science classes. I was involved with a lot of community health efforts. I went to CUNY City College, and so we had, I think one semester there was a public health like internship that I had done, where we essentially had to design a campaign on our campus to promote health literacy. And so that was really my first foray into public health. And then in my junior year, I did a study abroad in India at a global health comprehensive health center, which is really centered on learning, how community health workers are used to reduce health disparities in communities that don't have access to doctors. And so I think spending time there really opened my eyes to the different avenues to, improving health and treating patients. That wasn't just med school. And so when I came back and after I graduated, I worked in the clinical space for a little while in an ophthalmology practice. And I think I was coming against some of the same issues where, we're treating patients, but what are we doing to prevent some of the issues that are coming up? And so that's when I pursued my MPH. And then after that, while I started at Mount Sinai, I also started with the South Asian Public Health Association as a board member. And that really, I think, opened the doors to so many opportunities that came. And now it's like I live, breathe, and eat public health. I think there's just so much that you can do. And for someone who likes to do a lot at once, I think public health has that perfect avenue where you get to bring in your different interests. So my interests slide in a lot of public policy, research, medicine, and public health is really that avenue where you can take everything you're interested in and carve out a niche for yourself.
I love that. And I also love how you've highlighted the work of community healthcare workers because I think we often think of we often think there's a blur between public health and healthcare. And healthcare, obviously, we know can be within the four walls of a hospital or a clinic, but public health is everything outside of that, right? And healthcare does so much public health too. But it's really important that we understand, like, it's everything from the clean air that we breathe, the clean water that we drink, our lifestyle, where we live, all those things certainly matter. And community healthcare workers play such a pivotal role. So thank you for sharing your story. Maybe we'll move over to Maryeba.
Yeah, that's definitely an amazing question. I think one that a lot of us sort of get when we're in public health, that's sort of like why public health. And so, like sort of Samira was noting, like my journey started quite similarly too. I think the South Asian community, a lot of us, we oftentimes can find ourselves pursuing public health through understanding medicine. So I started off pre-med too, similarly. I actually went to like this biosciences academy in like high school, like everything was like geared up towards that. And then coincidentally, while I was an undergrad, there was one public health course being taught, and it was taught by the dean of the School of Public Health at the University of Oklahoma. And so he would come down to the undergraduate institution and teach. And so that was the first moment that I actually was really exposed to the topic. And I was like, wow, it is like all the things that I've often thought about. And I ended up pursuing an internship at one of the first ever community medicine schools in the US, which is actually based in Oklahoma, where they have public health fully interweaved throughout the sort of like medicine curriculum for medical students. There were about 3 medical students, 3 of us undergrad students. And so having that first initial exposure to public health and then pursuing that, I was known as a public health girl in that class, where they're like, she's always asking these questions about public health. We're trying to ask these questions about like, like the body and thinking about that. But I was like, yeah, but what about the air quality that they have? Are we checking their vents for mold? Like, the quality of the sort of experiences that we're having there. And I think you asked about defining moment. I think the defining moment for me was really, I was a junior in college at that point, closing out this internship after an entire summer and really, having didactic sessions, everything related to medicine, public health. And so we had an interview with the dean of the School of Medicine. And so he came down as a sort of honor to be like, okay, like, let me sort of do this sort of practice round with you all. He slides over my personal statement back to me after the end of the interview, and he says, "You're not meant to pursue medicine." And in that moment, I'm crushed. I'm like, high school me, undergrad me has worked towards this. I've taken so many classes. And he's like, "You are way too critical of the healthcare system." He's like, "You have to act like you like it to some degree." And I was like, "Respectfully, sir, like I grew up in Canada predominantly, up until like about the first year of high school." And I told him, like, I've seen good health systems work. And so I have critique, and I think there's like positive ways to grow and we need to build on that. And he's like, "I get that." But he's like, "Honestly, I think you'd be very well suited to get a doctorate in public health or a master's in public health." He said, "I think the questions that you were asking will be answered there and you can serve that." And so I think that moment sort of like lit a fire within me, where I was like, all of these sort of chips started like falling in place. And then I started taking in my last year master's level public health classes and had a lot of incredible mentors that really supported me through that process. And actually, the major of public health didn't even become a major until after I had graduated from the University of Oklahoma. So that's telling you about this sort of like access to this sort of knowledge wasn't readily available. I had to definitely hunt and go out and seek there for it. So yes, I did have a bit of exposure, but it's been a path that I've really sought and ran after because I feel like it's so important and I really value that.
I love that. And I think it's so important that you highlighted, what your, your teacher or mentor had mentioned. I think it's important to be critical, right? Because we're not critical, how are we going to improve anything, any system, any policy? If we think everything is all fine and gravy, then nothing is going to change and we'll always be at that status quo. So I think it's so important to be critical. And I'm so glad that you chose the field of public health because I feel like there's so many things that we do well. There's so many things that we need to continue to improve on, and there's so many different weaknesses. And oftentimes we say, public health, the work is invisible. And then when the Tootsie Roll hits the fan, people are like, "Oh my God, where's public health?" And they're like, "Well, you didn't think of us when everything was working well because when the sky is blue, the air is good, and the water is clean. You don't think of the day-to-day work of public health. But when something goes wrong, that's when everyone likes to point fingers. But there's still a lot of great work to be done. So I'm so glad that you chose this field, and love to kind of tease out some more of your story and some of the next questions. But I'll hand it over to Fatima to share her story to public health and her defining moment as well.
Absolutely. My story really began with noticing who got access to public health. And really, what I've noticed between both these answers is the common theme of the scope of the entire public health field, where it's not just limited to specific careers that we would normally expect, but there's intersections with public policy, AI, business. And so growing up, I was constantly surrounded by a lot of ambition, a lot of inspiration. My mom is a physician, so I saw firsthand exactly what it's like to work in that healthcare field with all these different specialties and day-to-day patient interactions. And so growing up, my mother always instilled in me values of community service, whether that was volunteering in the hospital with her, delivering gifts, or just at a food bank. And so from a very early age, I had a good understanding about public health. But it wasn't really until COVID-19, which I experienced very, very young during my 13, 14-year-old age, about to enter high school. So there was a lot going on. And that's when I really understood what public health meant. It's not just this field about medicine, but rather it's the impact and intersection among so many different fields. And it's really at the center of our society, which unfortunately often gets forgotten until times of crisis like the pandemic. And so as I moved to higher level coursework in high school while also growing up with the pandemic, I did more research in computational biology as well as some clinical opportunities. And while I was there, I noticed that I was always the youngest person in the room. And I've always been very, very grateful for the opportunities I've had and the research opportunities I've taken up. But something I noticed when I was winning all these awards is the conversation was always centered on, you're so young, this is amazing, we need more students like you. It was never really, how do we create opportunities to have more students? And so since then, I was on a mission to really, I guess, open up the gates and create more opportunities for younger students who might not fully understand public health, or really create these bridges among different fields. Not everyone wants to be part of public health, but they might not realize their interest in policy or business overlaps with that healthcare sector. And so that really led to the inception of North Star Research. And I'd say my aha moment wasn't just like one pivotal moment in high school, but it was rather a buildup of all the experiences I had since growing up, experiencing the pandemic, going to conferences at a young age, and really just taking a lot away from these conversations I had and reflecting on my journey. And so since then, I've been on a mission to not only do what I love and am passionate about and help those around me, but create opportunities to really have that long-term systemic change that we need.
I love that. Thank you so much. And I'd love to ask you another question, and I'll move on to our other amazing speakers as I have additional questions for you all. But as the youngest first author of a UN policy paper, what did you learn early about credibility and influence?
Absolutely. Before I even got into research, what a lot of people don't realize is just how much dedication and commitment it takes. I remember cold emailing more than 250 professors to give me a chance, take me on. And I just remember so many no's and no's and no's, and it can be really disheartening. But I was lucky enough to, stay persistent, stay very, very committed, and prove myself. And so I persuaded Dr. Patrick Slade, a Harvard professor, to take me on, include me into his research. And so, but when I joined that lab, I really wanted to do a little bit of policy research. His research, the Slade Group, focuses on disability assistive technology and mobility. And so while in that opportunity, I kind of like brought on my own project, not just taking a backseat or doing some literature review. I kind of wanted a firsthand experience. And so in that role, we studied disability assistive technology policy in Arizona specifically, just because Arizona has a huge public health department, a lot of funding, but I wanted to study exactly what that funding looks like and how it's going and how policy is working. And so later on, that got accepted as a policy paper into the UN. And again, that was something I was looking into. I was reaching out to people, going to conferences, and really seeing what I could do about that. And so the research opportunity was amazing, and it was a result of all the persistence I had, but it was also the result of taking charge and leadership as well as collaboration. And so after the paper was submitted and accepted, I didn't stop there. I continued sharing the research, sharing opportunities, and really having conversations with other students, hearing their ideas, giving suggestions how they can take it further and not only explore their interest in one field, but again, combine that with so many other fields while also, again, just staying motivated and galvanized in whatever it is they're passionate about.
That's so wonderful. And I love how you're lifting the community as you go along and you're really, and motivating other students around you just to continue to push forward. So that's amazing. And thank you for everything that you're doing. It's really inspirational. Wonderful. So next, I'll go to Samira. So as a president of SAFA, or and if I'm mispronouncing that, please feel free to let us know how to pronounce this as SAFA. What's one South Asian a health issue you feel is still misunderstood or under addressed?
Yeah, so it's funny with SAFA, it's a lot of times, if you're looking at it from the global policy perspective, our data is not counted. And so, data disaggregation is a very big issue. And so it's hard to pinpoint, what is really driving some of the issues in our community because a lot of our data is aggregated into the general Asian terminology. We've made inroads in cardiovascular disease research, but really, everything else we are left out of discussions and usually just lumped into Asian American, and then that really, kind of downplays the effects of some of the health disparities that we have. But on the South Asian community side, I think we've made some progress with mental health, but there's still a lot of stigma surrounding it. And so a lot of times people, people started talking about mental health, but it's always at the point where they're like, okay, yeah, other people have that issue, but I don't have that issue. Or, people have an issue and they should see someone, but not my family, not my, us. And oftentimes people are still stigmatized for seeing therapists. And it's really a growing issue, especially since the pandemic. And one thing that we're not talking about is I think, loneliness epidemic in the aging population of South Asians, right? With our community, we love to socialize, especially our parents and our grandparents. Community is essential to them. And that's also a lot of times where they're able to get out of essentially the stuff that they're stressed about by talking about it with other people. And so during the pandemic, there was a lot of isolation. And so that really worsened a lot of mental health issues. And we've also seen that, a lot of these early on mental health issues can lead to other problems like dementia and other neurocognitive issues. And I think the linkage is not discussed enough. And so when we talk about preventing things like Alzheimer's disease, what does it mean to take care of your brain health? These are conversations that I think are, again, linked to the stigma that's surrounding mental health that we're not talking about. And so while the younger generation, I think, is a lot more open about talking about mental health, we don't really talk about it with our parents and our grandparents. And we don't talk about how do we identify some of these issues within the aging community and how do we prevent it. And so I really think that those are areas that are both understudied given the lack of data disaggregation, but also not really talked about within the community.
That's wonderful, and thank you so much for sharing that. And I think just even on a personal note, I have parents. My father had a massive stroke about 8 years ago, so he's bedbound. He's kind of like, as they say in Urdu, na hone ke barabar hai. It's like he's there, but he's not there. So my mom is always very lonely. And when there's 5 of us, and we often say, we really need to do more and get her involved, and she's just always home, and this is not good for her mental health. And she was such a social butterfly. She used to, lean on my dad to take her places. And so I see more and more of that in our older population of, living oftentimes in silence. And we know that we're such, the social aspect of our community is just so important. And so we'll love to see, have there been any strategies that you've seen that actually work to shift beliefs and behaviors?
So with my time on the board within the PIMA, which is the National Asian American Native Hawaiian Pacific Islander Mental Health Association, there's been a lot of, talks of alternative ways to talk about mental health and group therapy, right? Especially with the older population, aunties are not going to feel comfortable going to a therapist and talking about it, nor are they going to feel comfortable going with a bunch of strangers that they don't know to talk about it. And so an initiative that they've started is having, this one is tailored more to the youth, but there's other initiatives similarly with the older population, is like these group, just coming together around a different topic, whether it's a cooking class or something, and really, kind of just letting loose, talking to each other, talking with your friends. And I think we don't really, in the Western sense of mental health, a lot of it is you need to go see therapy, but we don't take culture into consideration and what works for our community. And so whether it's having these parties for, the aunties in the community to come together at community centers like mosques, these things really do help bring people out of their shell and helps them come together. And so a lot of it is not talked about. There's also efforts to disaggregate that data. So there's research out there, like for example, there's a study called the CARE study, which is enrolling older Asian adults into the study and then disaggregating that data. And it essentially allows researchers to then contact these people to conduct more research that's focused on, South Asian communities, Asian communities, and really ensure that we have proper representation in this research.
That's wonderful. And thank you so much for the work that you do. That's so important. We'll go to Maryeba next. So in your CMS work, what's one systems issue the public doesn't realize is shaping health outcomes every day?
Yeah, that's a great question. I think there's so many that come to mind, but I think from like a big picture lens, I think currently within this administration, it is like fighting an uphill battle where there are constant attacks on public health authority, where before mostly we were seeing it at the state level. So coming from a state like Oklahoma, you can imagine about like the controversy around just generally being putting out candid public health legislation related to even vaccines that you'd be like, oh, this is something that, across the board you should be able to agree on. And so now sort of seeing this at a national scale is really, really interesting. And I think one sort of key issue that I think a lot of people might not really realize and is very, very important is the expansion of Medicare and Medicaid access. So one of the projects that I work on day to day is expanding Medicare networks. So, the government tells us that we offer these benefits to our citizens. We are offering Medicare and Medicaid. But in terms of thinking through the logistics of, okay, so how does that access really look like for individuals? So, if you go around and a lot of the providers in your area are not accepting Medicaid patients, then you don't actually have access to a doctor then. You have this insurance, you don't have anybody to see because historically, Medicare and Medicaid patients, doctors are able to make less money off of those kind of patients. So they will prefer other sort of patients that have higher sort of premium insurances. And so they get to be able to keep their practices open. There's additional factors on their ends that they do have to consider. And so actually it can cost them sometimes to treat sort of patients like this. And so day to day, what we're working on is looking at these insurance companies and saying, okay, how are these networks that you all are sort of committing to actually coming through within fruition? And so based on a certain geographic area of where Medicare beneficiaries live, we look at time and distance standards and look at the calculations based on that and making sure that we uphold these plans to what they're saying. And so this goes back to fraud, waste, and abuse conversations that we have at the wider public health law level. And so I think this is a lot of very, very critical work that's happening, and I think is more so the operational implementation side of the public health scope in conversations that we often see.
It's amazing. I mean, the operations side is the bread and butter. It's where rubber meets the road. So it's so important. And, we'll love to follow up on that. How do you balance like the data, the policy, and like the human impact that you're mentioning, especially when decisions could have real consequences in communities? Any thoughts, or how do you navigate those spaces?
Yeah, that's a really great question. I think for now, what we're trying to do is more so change the messaging, but not the operations. So if certain language, like the word diversity, even if you're talking about data diversity, is something that's not suitable, we pivot the language and we continue the work in that effort. And so also just generally in my personal life, thinking about the community impact. So my day job, like I work at the more federal health policy level, but community is something that's so rooted within the South Asian community. And so I always make sure that I'm giving this public health knowledge back outside of this. So I did this through the Oklahoma Public Health Association. I was their conference director, leading the largest convening of public health experts in the state. It was a 2-day event, 300 plus attendees, tribal health leaders, rural health experts, senators, experts like that. And then when I moved here over to California, I became the vice president of the Southern California Public Health Association. And so I really want to make sure that I'm pouring back into the community and every sort of area that I touch and pushing this information forward, because I know coming from a low resource state like Oklahoma, I wasn't exposed to this knowledge. And if there are minoritized or underprivileged individuals, I want to make sure to carry that torch forward. And one of the kindest messages that I got recently from Columbia admissions representative who admits people for the public health school, they said, after you graduated, we saw the largest increase of applicants from Oklahoma. And we know out of the class, you were the only one from Oklahoma. So we attribute that to you. And knowing that sort of my impact does continue on from me. And so it was such a awe-filled moment, and I was like, wow, my work is definitely making an impact. And then also at the end of this year, recently I got the American Public Health Association's only National Early Career Professional Award. So out of an organization of 25,000 outstanding individuals, it's very humbling to follow in the footsteps of leaders like yourself as well, and so many others that I look up to. And I hope that I can carry that torch forward, like I said, and do right by everything that's been poured into me.
It's amazing, and congratulations. So well deserved. I mean, you do amazing and impactful work, and you're so passionate about it, and it shines through. So So amazing. So thank you again for your service. I love it. I love it. Well, I have a question, for all three of you, and this is on just generally the advice that you would give to other students that are aspiring to be in public health. What advice would you give to Pakistani American women, and then just students in general considering, looking into getting into public health careers? And so maybe Samira, we'll start with you.
Yeah. I think one advice I would give is to follow the impact you want to make and not the title. Oftentimes people are, they have a very linear path and they're like, okay, I have to do this and be this and follow this person's path. But I think in public health, the great thing is that any path will lead you to the outcome you want. And so the goal really is to follow what impact you want to make and then insert yourself in the areas where you can see yourself making that impact, whether it's volunteering, um, you know, trying out new jobs, really just finding the areas that you want to make impact in, and then naturally you'll grow and be able to see a career path form together for you.
Wonderful. Thank you. Fatima, we'll go to you next.
Absolutely. I think a really great piece of advice I'd give a younger person or my younger self would just be that impact matters so much more than achieving perfection. I think a lot of times we get so caught up in getting the ideal results we had planned for, or getting the results of success that we can share and having this inspirational story. But inspiration is more than just being perfect or getting that amazing outcome. It's about sharing your struggles or the rigorous challenges you faced and how you persevered and what you're going to do next that matters more. Early on, I often felt pressure really to do everything flawlessly, especially as I kept being recognized with all these accolades and achievements. I felt like I had to kind of measure up and meet what everyone expected of me. And really, over time, what I realized is that real change comes from starting before you feel like you're ready. It comes not from planning this linear idea like one of the other members was mentioning, but it's more about following your passion and seeing where that takes you, even if it's not necessarily some amazing research project or idea. It might just be learning and just gaining more knowledge about something you didn't know before. But again, that's all building up to impact. It's all building up your passion and motivation and inspiration to do something. So I guess I just say that impact and really having that motivation, having that spark that's always pushing you is so much more impactful, so much more necessary than achieving a result or getting some perfect outcome that you would have planned.
Absolutely. Thank you for sharing that. Maryeba.
Yeah, I think I have two pieces of advice that I give to students. First one would be closed mouths don't get fed. Seek out opportunities. Oftentimes we sit there, we wait for the perfect opportunity to fall into our laps, make them yourself. You know, like Fatma was saying, like, I messaged this sort of individual to pursue research with them. And I think that's an amazing thing. And oftentimes in our community, we can sometimes wait our turn too often or think about, oh, I'm not there yet. This sort of point of readiness might not always be achieved. And so, pursue those sort of opportunities that are on the table. And if not, create them and put them on the table yourself. The second sort of piece of advice I would have is don't lose hope in mentorship. And so I say this because I was having a conversation with a bunch of my public health friends from grad school. And so we were sitting and we're all women of color from different backgrounds all across the world. And we're saying it's so interesting that our most strongest mentors are actually white men. And we were so shocked by that. And we were thinking about that. And so one, of course, naturally, I come at this from a DEI perspective. I lead the DEI work group at my company. It's a 550 person work group member. And so I teach lessons on this. And so I was thinking about, okay, so why would that be? And so in my opinion, oftentimes with that position comes privilege and power and access that they're much more readily able to pass on to individuals like us and are able to open those doors. And so I approach these dynamics with nuance and understanding rather than judgment and thinking about, oh, well, maybe sometimes we lose hope in mentorship, but maybe we're looking for more individuals of color within our community. And we're like, maybe why aren't they there for us? Why aren't they supporting? So I would really encourage students to understand really in sort of highly competitive and resource constrained environments, the scarcity mindset can unintentionally emerge, even among those from marginalized groups. And so it leads to withdrawal or limited support sometimes, because it feels like sometimes people can be fighting for opportunities. But I would say that although that's something that you should take into account and acknowledge, keep pushing for finding good mentors. They are out there, and I've ended up finding some incredible ones that are women of color. And so I would say keep finding that because it's so, so important. And I think we all talk about representation, but sometimes the logistics of mentorship is something that can fall through. And so approaching that conversation with understanding and humility rather than judgment, I think is key.
That's so amazing, and thank you. You said that so perfectly. That's really, really well said. I will share, as someone that was early on in the field of public health, I didn't see many faces that look like me or many internship opportunities, and so that's why in the work that I do, I started this internship program for special pathogens and then a fellowship program in climate health, among some other things. And happy to share that it's one of it's one of the most competitive programs that's available in the field of special pathogens. It's probably one of the first ones of its kind when I had launched it, and we've had over 30 really highly qualified, successful students that have gone through from undergrad to grad school. And it's just been really an inspiration. But really, my motivation for starting that is really to give back, and the fact that I didn't have this growing up, and wanting to pursue a field in public health was just something that I really wanted to do. So I'm so glad to hear, that, so many of you have been inspired by different internships and maybe even mentors, along the way. So that's wonderful. And I hope other people have similar opportunities as well. So with that, I think we've had just an amazing conversation with all three of you. You have just really been an inspiration. You're uplifting the community as you're going, as you're moving along. And so as we close, again, I want to thank you, Samira, Fatima, and Maryeba, for showing us what the future of public health can look like, which is rooted in service, grounded in community, and unafraid to lead. And we need that in today's world. I will share a skill set that I think is just so needed, that I hope each of you have either embarked on or looking of doing, or maybe have already done, which is science communication. Because in today's world of mis and disinformation, of AI is amazing, but then you can also have so many things that you can't tell whether it's true or whether it's not. And you want to make sure you have individuals like yourself providing good science communication on an ongoing basis. And that is something that I was never trained for, even though I was in public health. I am in public health. I live and breathe it. I was never media trained. My very first media ask was to be on Netflix, and I had, turned it down 3 times because I said, I'm not an actress. I'm someone that's behind the scenes. And so when they finally said, we don't want you to read lines, we just want to video, we just want to record you in your meetings and what you do, and, at work. I was like, okay, that's fine. That's when I finally agreed, and they had followed me for about a year. And then the series finally released in 2020. But then after that, I've done 300 media interviews, but again, I was never trained for the media. And so I had to self-train myself. And one of the things that I keep telling, students and undergrad and graduate level students is you really should just take either some media training or just educate yourself in science communication, because we need more people in this field to share good science, to be good representatives of public health. And it's needed now more than ever. So a couple additional takeaways that I've had from today is public health needs more voices like you, and the voices that you shared on this platform today. We need more lived experiences, more leadership that reflects the communities that we serve. And so I really hope that for those that are listening today, that this conversation has inspired you, and to really even pursue a field of a career in public health. So with that, I want to again thank you for joining us, and congratulations again to our APF Rising Stars. So with that, I will hand it over to Maha to close us out.